Hello, I'm Kayla Roman. I will be highlighting top professionals providing senior financial services. Today we are meeting with Steve. Hi, Steve. How are you?
Hey, doing great. Thank you.
Good. Do you want to start off just by telling us a little bit about yourself, what you like to do in your free time, hobbies, anything besides work?
Well, pretty much just we work a lot and insurance and everything, and then of course my family's a second. Is takes up a lot of my time too. I have a daughter who is freshman in high school, and so that's a lot of activities there with theater and dance and just archery and all kinds of different fun things like that. Other than that, when I get free time, I like to fish and we do a lot of target practice with archery and guns, stuff like that.
Okay, cool. Do you want to tell us a little bit about what led you to working in insurance in general?
Truthfully, I was very young. I was just 20 and had just was trying to find work, and a friend got me a job with Mutual of Omaha. Never imagined myself doing insurance or anything of that nature, but it just sort of presented itself, started into it, and just kept growing in it. And that's just, where the career path has led.
What led you to working with seniors on their specialized insurance needs?
From the very beginning in insurance, what we typically did there with Mutual of Omaha was in individual health insurance and Medicare insurance. That's just sort of what I was started out in. Although we do pretty much all lines of insurance and stuff, that's always just been sort of my particular thing. And over the years, we've grown in it. Lord's blessed us immensely, and we're able to facilitate insurance, with a lot of seniors in a lot of the area. We don't have just one particular area. I'm licensed, I think, in 7 different states. So we do Medicare insurance for a lot of people in a lot of places.
What do you think are some of the biggest challenges that you see your clients facing regarding their financial situation?
Currently would be inflation is just really taking such a bite, because the biggest problem you have when you're a senior, especially, we deal with a lot of people just coming in retirement. So they're having to learn with the fact that their income is fixed. It's not going to change, but what they spend is a variable that, again, with inflation here, it's just increasing at a rate that their income's really not keeping up with very good, and so it really puts them in a bad situation unless, like at times.
Yeah. What goals are you able to help your clients obtain?
I think what we bring to the table is year-round service. There's a lot of places out there that sells the exact same thing that we do. But where we differentiate ourselves is we're not just trying to sell you something and then we're like some call center from some faraway place that you'll never talk to us again. We're a local agency with a local presence, been there over 30 years, and we are there year round to take care of our customers. So the thing that we really bring to the table is that down through the year, if you have questions or issues or concerns, you start with our agency, and we've got a pretty good staff there to be able to help people. The second part of it is we're an independent. I'm licensed with over 100 different carriers, and so pretty much, if you come in to talk to us, we can offer virtually every plan that's available where you live at, and but we try to learn a little bit about the person to see what their situation is, to figure out what plan would fit their needs the best.
Without divulging any specific details, can you tell us about a time where you helped a client achieve or overcome like a challenge that you see pretty often for the seniors?
Well, yeah, one case here in particular, not too long ago, we had a customer that had some pretty unique health issues. And, we're sort of in a rural area here. Our level of care here at the local hospitals and stuff, and not knocking them or anything, but there's other places in, like Cleveland Clinic and places of that nature that maybe can do things that's just not available to be done here. And we had a person in a situation that they were having some issues being able to get the care they needed here. And we helped work with them and worked with the insurance and their provider and stuff to help get them took care of over at Cleveland Clinic. And so they had a good outcome on that, which maybe they wasn't able to go to Cleveland, and they didn't have the family and the support that could help them navigate to get there and stuff like that. So we was able to help with that. So that felt pretty good.
Yeah. If you had a crystal ball and could see into the future, what do you think is going to be the biggest challenge for seniors in the next 3 to 5 years?
As far as on Medicare, the changes that's upcoming in the prescription drug plans, that's going to be a big issue. The federal government just passed a law that over the next couple of years, they're going to be lowering the out-of-pockets that people pay as a total for the cost of their medicines, which is a great thing. But I think unintended consequences of that is that the cost of those drug plans are going to significantly increase in the next couple of years over what they were. And a lot of people's having a tough time as it is. And then the other thing is looking like it's going to be happening here is the people are going to have to start paying a good bit more up front for the cost of their medicines in order to have that out of pocket lowered. And so that's going to be a real challenge for a lot of our customers.
Yeah. Okay. Well, thank you, Steve, so much for meeting with me today and answering a few questions for me.
Sure, no problem.
All right. Thank you so much. We'll talk to you later.
Take care.
Bye.
Bye.